name's Laura Kirchville. I'm an HCC student nurse. I'm here to do a head-to-toe assessment.
Hi Laura, thanks for coming. I'm Liz Kelly.
Nice to meet you, Liz.
Nice to meet you.
As Liz walked in, I noticed that her gait was even and steady. She is dressed appropriately for the weather, and she has no odd mellifluous odors coming from her that would indicate that something was wrong. Liz, I'm going to be using wipes. I've washed my hands prior to coming in. I've introduced myself to you. I'm going to protect your privacy, and that means you're going to be keeping your clothes on throughout the entire assessment. I'm going to explain everything before I do it, and I'm going to ensure your safety during the assessment. Sound good?
Thank you. Sounds great.
Excellent. Before we begin, how about some simple range of motion? Is that all right?
Yes.
Okay, excellent. Just, make sure that everything... Beautiful. Range of motion is good. Do you have any limitations?
No.
Beautiful. Do you know where you are?
I'm in East Hampton, Massachusetts.
And do you know the date?
November 18th, 2012.
Excellent, because it is November 18th. Would you like to sit down?
Yes, please.
From those questions, I know that Liz is alert and oriented ×3. She can follow directions, and she can make decisions for herself. Excellent.
Thanks for the chair.
Well, you're welcome. I'm going to start with your head, and we'll work our way down.
Sounds great.
Excellent. Liz's hair is clean. It is well kept. I am noticing nothing on her scalp that indicates she has no moles, she has no lesions, she has no redness, she has no oozing on her scalp. Her skin is dry and warm to the touch. Wonderful. Just going to check your ears real quick, okay?
Okay.
No oozing, no redness from the ears. Very good, very good. All right, your eyes are open, they're symmetrical, lovely. I'm just gonna check your pleura, it's the white part of your eye. Very good. And she has even pupil dilation, and your eyes look good. No redness, no petechia, very nice. Her mucosa is pink and moist, the way it is supposed to be. Her lymph nodes feel good. Carotid arteries, good. Skin turgor, very good. So you're drinking plenty of fluids. How's your sleep?
My sleep is good.
Take any sleep aids?
No.
How many hours a night do you generally get?
About 7.
Very good. Excellent. Right. I'm going to listen to your lung sounds right now. Is that all right with you?
Yes, it is.
Okay, we are done with the head. Moving on to the back. Any breathing problems?
No.
When I was checking your neck, I should have asked, any difficulty swallowing?
No, none at all.
Any choking?
No choking there.
Okay, excellent. Very good. I'm going to be following the Z pattern as I'm going across Liz's back. I'm going to listen to all 3 lobes of her lungs. Deep breath. If at any time you feel dizzy from all of these very many deep breaths, we can stop. It's okay. Just let me know. Very good. Sounds like you're breathing through a empty paper towel tube. Very good. That was your upper lobe. Middle lobe. Very good. Lower lobes sound good, like you're breathing through a straw. I hear no crackles, no wheezes. Crackles are when it sounds like you're rubbing hair together through your fingers in your ear. Very good. Your lung sounds are excellent. You just lean forward a little bit. I'm going to palpate your lungs. Make sure you've got even distribution. Very good. Her lungs are filling evenly. Very good. Excellent. Why don't you, since you're already leaning forward, I'm going to go ahead and check your spine. If you could just lean forward a little bit more. Spine is good. Very good. Anything uncomfortable? Do you have any pain? Did I ask you this? Okay. So on a scale of 1 to 10, you would be a
0, 1.
0. Okay, excellent. Now listen to your front part of your chest, your lungs. Okay. Sounding good. Any difficulty breathing ever at all?
No.
Excellent, because your lungs sound good. I'm going to go ahead and listen to your heart while I have the stethoscope out, and then I'm going to move down to your abdomen. All right?
Okay.
Okay. Good, strong. Very good. Normally I would not be doing this with clothes on, but I'm protecting privacy. I'm not getting fresh, huh? Beautiful, loved up. Okay, one more time. And very good. Your heart sounds great. I'm going to go ahead and listen to your bowel sounds, all 4 quadrants. How's your diet?
Good.
Vegetables?
Vegetables,
Protein?
starch, meat, at least 2 square meals a day, and a few very healthy snacks in between.
What?
Crackers.
Lots of bubbles and gurgles. You've got good bowel sounds in all 4 quadrants of your belly. It's soft. It's not distended. A soft belly is good. It means that you don't have any obstructions. Speaking of your bowels, how's your poop?
It's good.
Soft,
Regular. It's
formed,
formed, I guess, would be the word.
okay, and regular.
Regular, yeah. At least every other day, typically once a day.
Okay, just gonna palpate. Very good. Okay, do you need to go to the bathroom?
No.
Okay, good. I'm gonna
No,
palpate your
what?
no. I'm palpating your bladder. That would be one of those bad things we try to avoid. How's your urine? Your pee?
It's good.
Well, your bladder isn't distended. Everything feels normal. Nothing hurts.
No,
Still
nothing
0.
hurts. Yep, still 0.
Excellent, excellent. So your urine it's pale, it's clear, it's cloudy, it's dark
Yeah, it's
yellow.
like a pale yellow, almost clear color.
Not highly scented or ammonia-ish.
No, no smell.
Excellent, excellent. I'm going to start with your pulses now. I did your carotid, and I'm going to, and your skin is still dry, it's still warm. Can you hear that?
Yes. Yes.
How many fingers?
2, 3, 4.
Vision is good, your hearing is good. Now we're done with the head. Alright. Now I'm going to move on to the pulses. Good. Brachial pulse is good. Now to do your blood pressure, you have this done regularly whenever you go to the doctor?
Yes.
Do you know what it is normally?
Like right around 120 over 80 typically.
Excellent. We're going to take your blood pressure right where my fingers are. It's about an inch. So about an inch from the apex of your elbow. I'll put my cuff on. I would take my scope out and I would take a good listen while I pump it up and listen. Okay? Now I am going to take your pulse. It's going to take about a minute. Are you alright with that?
Yep.
Okay, we're not going to be talking or anything. I'm just going to be doing it real quick. Take about a minute. Starting. pulse is good. It's 80, which is not bad, considering I know you were pointing. I see you've got kids.
I do.
So your activity level, how's that?
Very active.
Very active. Well, you're getting enough sleep. You're getting enough
Yes.
activity. That's good. How's your support system?
It's great. I've got some awesome neighbors, great family. My in-laws are wonderful.
That's fantastic. Good. You're safe in your home.
I am safe in my home.
That's a standard question that we have to ask nowadays, sadly. Okay, I'm going to check femoral pulse. I
Okay.
apologize. Yep, and popliteal. Blood implants are wonderful to feel popliteal through. You didn't have any edema in your arms. I'm going to check your ankles
Okay.
after I do your peel pulse. Good pedal pulse. Checking your skin. Your temperature is good. Your skin is still dry. It's still warm. Excellent. I see no edema. No evidence of lesions, scarring, moles. Okay. Can I just get you to... Good. Okay, push down. Very good. And we're going to do the hands. Squeeze. Very good. Push. Very good. Good. Gross motor is good. Excellent. You do self-breast examinations,
Yes.
and I know you're not 30 yet.
No.
Okay, so have you had a mammogram?
No, not yet. My doctor's not recommended it.
Doctor's orders. Very good to listen to a doctor. So when the doctor suggests something, you're compliant.
Yes, very.
Good. Excellent. So, speaking of breast, are you sexually active? You have
Yes.
children. Are you sexually active?
I
So-
am.
Okay. Are you protecting yourself during sex?
I've had the same partner for 8 years. We use birth controls. We don't want any more wonderful children, and you protect yourselves from STDs.
Good to know. Good to know. Good to know. Okay. So I have listened. I have examined your head. I have examined your chest, your back. We've done bowel sounds, diet, activity, support, drinking, drugs. Can you do any of that?
No, minimal, like alcohol at the end of the night occasionally.
Mm-hmm. That's good. But no.
No drugs.
Oh, good. Excellent. Your sleep is good. So your activity level is good. Any nausea?
No, I'm not a big fan of it. I don't like to do it very much.
I don't know anyone that does. I haven't met anyone like that yet. Well, thank you very much, Liz. I appreciate you taking
Thank
your
you,
time out of
Rebecca.
your busy schedule